9 out of 10 women have a cold uterus. Try these 5 warming techniques to boost qi and blood. Even your skin will glow. As the saying goes, a cold uterus is not a disease itself, but it leads to many health issues if left unaddressed. In today's world of iced drinks and air conditioning, cold uterus is increasingly common among women. Many female health problems are directly or indirectly linked to cold uterus. Cold uterus is a traditional Chinese medicine, TCM, term meaning the uterus is affected by cold. In TCM, the term uterus, baogong, includes not just the womb but also the ovaries, fallopian tubes and surrounding reproductive organs. Cold, in this context, can stem from external cold exposure or internal yang deficiency, especially related to the kidneys. Common symptoms of cold uterus may include cold sensation in the lower abdomen and limbs, low libido, frequent urination or mild incontinence, dull or sallow complexion, watery and excessive vaginal discharge, irregular or painful periods that improve with warmth, deep, tight pulse and a pale, moist tongue coating. Note: you don't need to show all these signs. Even 1 or 2 may indicate an underlying cold uterus pattern. 2. What health problems can cold uterus cause? Though not a disease itself, cold uterus can lead to a wide range of gynecological and fertility problems. Common clinical findings include delayed or scanty periods, painful menstruation, amenorrhea, period-related bloating or diarrhea, difficulty conceiving, early miscarriage, or ectopic pregnancy, endometriosis, chronic pelvic pain, vaginitis, or premature ovarian aging. In many clinical cases, women with cold uterus show signs of ovulation issues on ultrasound, and even if conception occurs, the low uterine temperature makes it hard for the embryo to implant or thrive. 3. How to warm the uterus and support reproductive health. In traditional Chinese medicine, the approach is simple yet profound. Cold is treated with warmth. If you're experiencing menstrual issues or are planning to conceive, it's best to consult a TCM practitioner for tailored care. That said, here are 5 powerful yet gentle lifestyle habits you can adopt to support a warmer, healthier uterus. Hot foot soaks. Soaking your feet in hot water stimulates key acupoints and helps improve circulation throughout the body, particularly beneficial for warming the uterus. Soak until you feel comfortably warm or begin to sweat slightly. Add ginger or mugwort to enhance warming effects. Do it regularly in the evenings before bed. Moxibustion, Moxa therapy. Moxa is a well-known TCM technique for warming meridians and dispelling cold from the body. It involves burning dried mugwort over key acupuncture points to improve uterine warmth and blood flow. Recommended points for home use: avoid during pregnancy, Sanyinjiao, SP6, Guanyuan, CV4, Taichung, LV3. Always ensure safety and ventilation during moxibustion. For best results, consult a practitioner to guide you. Sunbathe the back. Yang qi, vital energy of body, is often deficient in women with cold uterus, and the sun is a natural source of warmth and yang. Best time: 8 to 9 a.m. or after 3 p.m. Duration: start with 20 minutes, gradually increasing to 30 to 60 minutes. Target area: upper back and spine. Great for those with cold hands and feet, frequent loose stools, or low energy. Eat warm, nourishing foods. Food therapy plays a central role in TCM for managing cold uterus. The key is to avoid cold, raw or iced foods, and instead focus on warming, blood-nourishing meals. Try these warming recipes. The first one is brown sugar and ginger tea. Perfect for relieving menstrual cramps and warming the womb. If you like Chinese-style soup, you should definitely try Dang Gui and Ginger Lamb Soup. Ingredients: 30 grams Dang Gui, Angelica, 30 grams ginger, 500 grams lamb. Method: add to a clay pot with water, bring to boil, then simmer for 1.5 hours. Benefits: nourishes blood, strengthens yang, supports fertility. Moderate exercise. In TCM, movement generates yang, meaning regular physical activity promotes warmth and vitality. Aim for 30 minutes of brisk walking or gentle stretching each day. Avoid overexertion, especially if you already feel cold or fatigued. Movement helps improve uterine blood flow and relieve stagnation. Final tips for womb warmth. Don't overindulge in iced drinks, raw salads, or cold desserts. Avoid sitting on cold surfaces or wearing cropped tops in cold weather. Always keep the lower abdomen, waist and feet warm, especially during your period. Prioritize rest, emotional balance, and consistent sleep routines. If you are trying to conceive or undergoing fertility treatments, it is highly recommended to receive personalized support from a qualified TCM practitioner. With proper diagnosis and individualized treatment, cold uterus can often be effectively managed, improving your reproductive health and overall well-being. Our practitioners are professionally trained in both Chinese medicine and biomedical science, with clinical experience in Hong Kong and London. We're here to bring you authentic, personalized healing rooted in tradition and backed by science. Disclaimer: the information provided in this article is intended for general knowledge and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you are experiencing any health concerns or planning to conceive, please consult a qualified traditional Chinese medicine, TCM, professional for personalized guidance. Do not ignore medical advice or delay seeking treatment based on information contained herein.